Welcome to the Girlfriends and Boyfriends Guide to Alzheimer's. And I share this as a healthcare professional, as an integrative manual physical therapist. I treat cognitive Alzheimer's, mild cognitive impairment, concussions. I treat many things in the clinic through a holistic, whole person, identifying the systems that need to be supported with this disease process, among other things. I also share this as the daughter of an Alzheimer's patient. My mom was diagnosed in 2017, and I've been watching this since 2015. And I was the only one to notice it. Hey, there's something off with mom. Hey, there's something going on with mom. And it was so very, very, very hard and frustrating to advocate for care for her. Not only within my family, often I would get, hey Jen, she's just fine. Hey Jen, it's part of old age. Hey Jen, I forget things too. So there was, another one was, hey Jen, it's chemo brain. She was 1 year past chemo. She should have bounced back from chemo brain. Her hair never grew back. So there was so much denial of the potential of something being wrong, which it is. What an absolute scary disease. It's a horrible, awful disease to have your brain die and to watch the dying of a brain over time. And I don't mean to say it so harsh, but that's truly, truly what it is, right? As the brain plaques and tangles, decreased vascularity, there's shrinkage, volume shrinkage, which shows up on MRIs. There's the loss of the neurotransmitters. I'm not super up to date on the transmitters. I believe it's GABA, but the neurotransmitters do not stay in the brain as long as they need to. So that's where the medications come in, the Aricept and I'm forgetting the other one. There's Aricept and it'll come to me. There's a second one, which the intention of those drugs are to help those neurotransmitters stay in the brain longer and not dissipate. Those neurotransmitters are very, very important for nerve conductivity at the synapse level of brain neurons. So what I want to jump into is when we notice, hey, there's something wrong with my mom. Hey, there's something wrong with my dad. Because traditional healthcare still is not supportive, is not equipped to adequately handle cognitive decline, neurodegenerative disorders in a holistic, reverent manner. I'm just going to share my story of here's what I experienced, and then here's where I've sought help, and here's what we're doing in the clinic. So, as I live in a small town, it all depends on where you live and what you have access to. Many PCPs turn a blind eye to cognitive decline. I can't tell you how many times that I went with my mom to a primary care doctor and they just go through the blood work. Hey, your blood work's doing fine. Stay on your cholesterol medication, which I do believe that's a player. Stay on your blood pressure medication. That's a player. Quick side note with that, there's so much with regard to diet and lifestyle and exercise that can support our cholesterol and our blood pressure. Again, that is not being promoted by our doctors. They're just looking at labs, cholesterol's up, blood pressure's up, let's medicate you. But with every medication that comes into the body, that brings increased toxicity to the liver has to work harder. The liver is such an important player with regard to brain health, particularly with regard to the concept of fluid dynamics and pressure. And back to fluid dynamics, it is so very important. A super important job of the brain is the lymphatic system, the glial cells, the cerebral spinal fluid flow. So if that flow is impaired and that flow blends in with the venous drainage, so if we've got some backup, which if the liver is a little gunky, many of us have genetic SNPs, single nucleotide polymorphisms. It's just what's come down our bloodlines, our genetics. Many of us have genetics within our bodies that cause us to not have enzymes needed to adequately break down, metabolize, package, excrete toxins, medications, hormones, etc. So back to my mom. Oh, Donna, you're doing just fine. Here's your medications. Well, can we talk about, we've got some cognitive pieces. It was the elephant on the table that nobody, even the doctors, did not want to talk about. And even towards the end, as she got closer towards death, what can we do about it? And I think what it is they don't know what to do about it. There's not much that conventional medicine has to offer for Alzheimer's. They've got drugs, so they're focusing on drugs to create, support the neurotransmitters. There's a new drug, Limbaqui. I'm close to it. It's just at the tip of my tongue. But there's a new drug out there with the goal of it removing the plaques and tangles, which is a fantastic, exciting thing. However, that drug by itself does not address the disease process, why those plaques and tangles are occurring in the first place, nor does it do anything to restore and support the fluid dynamics of the brain, nor does it do anything to support the pathway. And I'll talk about what we're doing in the clinic with regard to supporting and encouraging pathways throughout the brain. I'm not saying that is bad, but we can't hang our hat on here's a drug that will cure Alzheimer's, because that's not the approach to look for. With regard to my mom, I'm very, very, very grateful for the Aricept and the, I want to call it Neuroptimal, but that's the neurofeedback that we use. I'm so close. It's not Neurotin. Anyway, the two drugs that we brought on board, and we would gradually increase them until we maxed out insurance and we won't pay for any more intensity of dosage because research says or whatnot. But I'm grateful because I feel in our case that bought us time that we needed for my particular family situation. Now for my dad, it's a different story. It's a different story. And I don't want to go too much into that. That's probably another chapter of it, how I'll be dealing with my dad differently with regard to the progression of his neurocognitive decline, with regard to personality, what I'm able to handle and tackle as a daughter, as a mother taking care of my children, and the battles that I choose. So back to my mom. We got a referral to a neurologist, I think maybe did MRI, maybe showed some age-related volume changes. And again, I still question, do we really, yes, what is the natural part of aging, but then what is an accelerated part of aging with regard to the lifestyle, diet, society we live in today. As we go to neurology, the most frustrating piece, I sent a letter before, an email, I'd like to talk to you in private before we talk about things in front of my mom, because it was so very, very hard. I didn't want to say these things in front of my mom. I didn't want her to feel like crap. I didn't want her to feel bad. I didn't want her to cry. She knew some things were wrong. At the same time, there's this denial, there's this fear. And what I would get from her is, you're just trying to put me in a nursing home. Hey mom, I love you like crazy, and I just want to do everything as much as possible to help you be as healthy as long as possible. I said that so many times because I kept getting, you're just trying to put me into a nursing home. How scary. Just the whole thing is scary, especially add on cognitive decline, cognitive impairment. So unfortunately, those messages weren't received. The doctor said, how can I help you? What's going on? And I'm trying to share the story without making my mom feel like, hey, my mom's changing. There's some things that are different. There's some things I'm concerned about. There's trying to give him examples of, just her behavior in stores is not her typical behavior. She one day was looking at bikinis. I'm like, what are you doing, Mom? Like, you've never worn a bikini. You're not shopping for a bikini. What was that? As I watched her just walk up to strangers and start talking. And she's a very, very social person. But this was different. It was almost inappropriate social behavior. And of course, telling stories over and over again, forgetting things, and just, she wasn't my mom. So unfortunately, what came out of that neurologist appointment was, hey, she's probably depressed. Let's put her on an antidepressant. That's what we got out of that. So sure, right? Let's do whatever we can. Let's try it. It was fascinating because my dad absolutely wanted nothing to do with it. Is that a generational thing? I don't know. But he was very, very against her being on an antidepressant. I don't disagree that she probably had some depressive components in the concept of neurotransmitters. Sure. So I ended up backing off because I got a lot of pushback from my family, a lot of pushback from my mom. Hey, Jen, she's just fine. She's just fine. There's nothing wrong with her. It's normal. So a couple other incidents were happening, and I couldn't not pursue it further. So I believe I took about a year off and let it go until I could no longer let it go. So I started to research. I live in Northwest Ohio, and I really continue to be not impressed with the medical systems in Northwest Ohio and Cleveland as well. I really struggle with the open-minded thinking and whole person thinking. It's not happening here at all. So I found a gerontologist. I searched. There was a gerontologist at the University of Toledo, and he recognized what things were. And he did a test called the MOCA. It's the Minnesota something cognitive abilities test, MO, capital C, capital A. And in this test, there's a battery of questions. There's a short-term memory. There's some long-term memories. There's draw the clock. I'll talk about the darn clock later. And so I'm watching her struggle, which was so heartbreaking to watch her not be able to do these tasks on this test. And I mean, my mom was a teacher, a reading teacher. She got her master's. She was a smart cookie, right? She was savvy. She planned trips and traveled and took care of finances and banking and so many things. So to see this decline was very, 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 to watch it in front of my face, I've been watching it the whole time, but to watch her decline, to see it on this test. So he was very, very matter of fact, which I appreciated. And I can't remember what her first MOCA score was. It might have been 19, might have been 13. And I can't tell you exactly kind of what those ranges are, like what you want to score when the brain is healthy and functioning. Although there's a couple of questions that I know I would struggle with that I think I've really struggled with. But then there's criteria where, okay, you fall in the category of mild cognitive impairment. Hey, you are falling in severe cognitive impairment. So he didn't beat around the bush. He said, hey, if we don't do something about this, she's on the fast track to the nursing home. And that was when we started medications. He also recommended neurocognitive neuropsych testing, which that was where we got the official diagnosis of Alzheimer's. Again, it was heartbreaking to hear my mom struggle through these questions. We were able to do a driving test, which I think she passed on the first time, but still I had concerns about her driving. What if she got lost somewhere? What if she's not paying attention? So I would drive with her in the car. But it wasn't hard to take away her keys. That was kind of the natural attrition for us. It was not a battle, thank goodness. So back to her story. That was all that we were given. The PCP still, hey, your blood pressure is doing all right, your cholesterol's all right, your thyroid's okay, stay on your medications, or maybe we need to bump your medications. So I would fill the PCP into, hey, here's some things that we're doing. So to fast forward, I began to learn everything I could about Alzheimer's for a couple reasons. So when she was diagnosed at that neuropsych testing, all I kept thinking of is, shit, I've got 20 years till my Alzheimer's kicks in. My mom, I believe, was 60. She had just retired. And she was helping me take care of my littles. So I believe she was 60. She died at 72. We had about 10 years of Alzheimer's. So she was about 65, 62, 63. So she was young. So that's an earlier onset of Alzheimer's. A couple other complications for her as I unpack her story. So it's so very important to unpack the entire medical history and story of everybody regardless, are you heading down mild cognitive impairment? Do you have GI issues? Do you have pain issues? What is it? Because everything that happens to your body is absorbed, recorded by the cells, by the tissues, by the brain. And unless it's addressed and treated, the body will accommodate and it will adapt until it can no longer adapt. On top of that, add inflammation from stress, which stress affects cortisol. Cortisol affects thyroid. Thyroid affects hormones. So that's where we start getting into the thyroid issues and the hormone issues, which are so very important to brain health. Cortisol, hormones, unpacking the story. Emotional trauma. So I saw that in my mom. I knew of some, and as I work with my patients, often there's an emotional trauma component. And this is where our work is very advanced. We're pioneering this work of what we do with our hands, with integrative manual physical therapy, with visceral manipulation, which most of this work comes from Jean-Pierre Barral. He's a French physio and osteopath in France. And fortunately, just by the grace of God, I found one of his direct studies, and she became my mentor. And then I've been able to study with Jean-Pierre as well. So with regard to the emotional, again, most people don't address these emotional traumas, but the concept of polyvagal theory from Stephen Porges talks about how the body will always try to feel safe. It will find other pathways. The body keeps the score by Bessel van der Kolk. So the body will stuff and store trauma in the organs in the body. And still there's not a whole lot to help with trauma processing. They're working on that in their fields, which is fantastic with regard to like trauma yoga, trauma-informed therapy, but a lot of it is cognitive work. As we get into the body, that's where we get in more at the subconscious level, but our advanced work, we are able to dive into that subconscious component with regard to our hands. So as we work the organs, we work the tissues, that provides the body an opportunity to process and move. The trauma doesn't go away, but our job is to help integrate those emotional traumas into the system so that they're not just stuffed and stored and festering, creating these adaptive strategies which often increase the sympathetic nervous system, which increases the cortisol, which throws off the hormone system, creates inflammation. So what I want to say is, again, nothing is simple. The body's pretty simple once you understand here's the different, it's not simple, but we have to look at the systems, the history of what's happened to these systems, and then how the body has adapted, and what do we need to support and restore to optimize the body's biological functioning and processing. Head trauma is a huge, huge factor that I see. I saw it in my mom, and I see it in probably every single patient who has mild cognitive impairment and Alzheimer's. There's been a history of concussion. Football players, wrestlers, like you hear of CTE, the chronic traumatic encephalopathy from the football players, and that's a big. Actually, my colleague has done she did a preliminary study that was published with regard to the work that we do and the retired football players, because her heart was so broken from the suicides that were happening from these retired football players because of what they're experiencing in their health. Inflammation is a huge player. Neuroinflammation, and what we eat and what we eat, and then toxins. So heavy metals can be a big player. I had all of my mercury fillings removed a couple years ago. Again, how can I decrease that toxic burden? I grew up in farm country, so we grew up around pesticides. Again, all of that burdens the body. The liver has a hard time doing its work to get that out. It clogs up the liver. It gets stored in the tissues, and toxicity creates inflammation throughout the body. Toxicity can also contribute to weight gain and hormone issues as well, again, through these metabolic processes, because toxins tend to be stored in our fatty tissues. And the more inflammation we have, our bodies tend to hold on to our fat tissues more. That takes us into insulin resistance, which also, this one's a little bit harder for me. I need to spend a little bit more time so I can speak more eloquently. But there's this relationship of insulin resistance restore and support a system. My mom was standard American diet. She ate lots of carbs. She tried to diet all the time. She drank Coke. So very, very inflammatory food. She did not exercise, so there's sedentary lifestyle, high stress. So a lot of those factors were setting her up for the expression of her gene. So with regard to genes and genetics, that is very, very clear. It's the APOE3/4 gene. I am close to being correct on that. I'll double check to make sure I speak more perfectly for that. But so there is genetic testing that's starting to be done. I never did that for my mom because I didn't think my mom was going to have Alzheimer's. I thought it was going to be my dad. So that surprised me with my mom. But I did do some genetic work. I think it's really important because I wanted to know how hard do I need to work? How tight do I need to be with my diet? How important is it for me to really stay on top of exercise? So I have one copy of the 3/4 gene, which is great. If you have 2 copies, that's even more concerning. I have 1 copy. So just because I have 1 copy, that doesn't mean it's the death sentence. It doesn't mean it's going to happen. But what it does tell me is, hey, I've got a genetic vulnerability for perhaps the development of Alzheimer's down the road. The beautiful thing that we're learning with regard to genetics is just because you have a gene, that doesn't mean that it has to express. The APOE3/4 gene also is involved in high cholesterol. I do not have high cholesterol. I've been taking care of myself really, really well with regard to diet and exercise, detoxification, stress work for probably the past 5-6 years. I have not expressed high cholesterol, so I feel like that's a testament to here's what we can do with regard to lifestyle to prevent, slow down the expression of the genes. So what we're doing and seeing in the clinic, I highly, highly recommend for everybody, whether you have especially if you have a loved one with Alzheimer's or you're concerned about yourself, follow the work of David Perlmutter. He's doing fantastic work in education as far as Alzheimer's and latest research and lifestyle and what we can do with regard to preventing it, slowing it down. Can we reverse it? We're trying. Why not? We've got nothing to lose but to try. So he comes from medical background, but then also he is very strong in functional medicine with regard to functional medicine. I encourage you also to find functional medicine providers because, again, we are astute in understanding the big picture, understanding all of the systems, and what happens when that allostatic load, when there's too much burden on the body, how that tips into disease. So again, it's our job to let's unpack the story. What do we need to address? Dale Bredesen's book, The End of Alzheimer's, I haven't read it in a few years. I need to, but that's a game changer. He really talks about, I think, excuse me, back at the time, it was 36 holes in your roof. And this is some of the things I'm talking about, right? Stress, head injury, diet, exercise, viruses, weight, hormones. So there's all of these holes that need to be addressed to support the system. So I highly recommend follow Dale Bredesen, read his book for sure, and then also David Perlmutter. So what we're doing in the clinic. So unfortunately for my mom, I struggled to get hands on her. So what I'm doing in the clinic with my hands is identifying, my tools are my hands, identifying the priority list of the body. Sometimes maybe the liver is the first thing. So let's start supporting the liver through infrared sauna, dry brushing, castor oil packs, supplementation, tweaking our foods to support liver detoxification. Sometimes we start right in the brain. Oh wow, there is huge leftover sequelae with regard to the structural optimization of the brain. So impact comes into the brain. Trauma or energy is neither created or destroyed. It is just absorbed by the tissues, and the forces go all the way into the brain tissue. So it is often my job, to go in there to decompress those areas that have compressive forces. when compression comes to the brain, there's also often some whiplash. So the whole concept of drainage, venous drainage, can be affected. So that's the first thing I look for is, am I feeling pressure? How well is the venous drainage? How well is the arterial supply? So those are things that we work on. We're highly, highly trained. So we work on that in the brain. I'm working on this, on improving, maximizing the cerebral spinal fluid, which is important for cleansing the metabolic debris of the brain. Most of that happens at nighttime. But if those fluid dynamics are impaired because of compressive forces that have come into the brain, literally tissues get stuck to each other. It will impede the flow of the fluid dynamics. We'll come down into the neck. We'll address arterial. So often I'm working on a carotid artery because we address the witness pulses and we can tell, hey, there's some diminished flow. And unfortunately, these things don't often show clearly on CT or MRI. They're things that are picked up just with our hands with regard to what our hands can feel based on the proprioception, the mechanoreceptors in our hands, concept of positive, negative charges with regard to fluid dynamics. So that's the work that I start to do structurally, is what can I do to optimize the fluid dynamics of the brain? What can I do to take tension off the dural system? What can I do to decompress, improve, decompress compressive forces into the brain tissue, improve vascularity into the brain? So there's things that I'm looking to pre-test, post-test to see how are we moving the needle. We also address, and I've got great colleagues who are doing fantastic work in it, diet and exercise and working cognitive health. And also my colleague, Nate Bergman, he runs Kemper Cognitive Wellness. He's so very thorough with regard to labs, and he dives into labs that are so much deeper and so much more informative than the labs that are done just generally on the surface that often come out fine, okay. But as he dives deeper into labs, it just gives us more information on how else and where else do we need to support this person with regard to medication or supplementation, or kind of guide us in what's the next right thing that we need to do. The next piece of work that I'm super excited about, again, we're pioneering this. We are probably the only ones in the country who are starting to pioneer this work with regard to optimizing the structure of the brain and the body as well, right? Because we work with the liver to support fluid dynamics of the brain. But what we're starting to bring into is working cognitive tasks while we're manipulating the brain. So what I've tended to find as we've worked is these patients are working so hard on their cognitive, and they're frustrated, and they know how important it is for them to score well on this test. So there's this panic, there's this fear, and what happens is when they go into this panic and fear, they tap out of the brain. And I can speak more eloquently to this, but that concept of lizard brain, right? We talk about like flipping your lid when you go into a sympathetic state. You're not able to utilize the entirety of your brain because you're in a fight or flight, a panic situation. So that's something that we've started to identify. Hey, you're going into panic situation. What can we do to help you get back into your brain so you can use it in entirety? The other component that we're doing, we do incorporate neurofeedback, which helps support the arousal states of the brain, the delta, theta, alpha, beta, high beta, gamma. That's another talk for another time, probably part 2 of this. But what we're doing currently is my colleague is challenging various tasks, whether it's short-term memory or attention, and that's her gift and specialty. Is here's these different levels of executive function. My job is to sit there with the patient while the patient is working, and I can feel where, hey, they're not able to access that frontal lobe. They're only hanging out in the occipital lobe. And again, this is the gift of my hand with regard to electroconductivity, to what I can feel with my proprioception, my fluid dynamics, my positive, negative energy in my hand. So that is what we do. So what we're doing is, as she's working, I'm coming in with both hands and I'm working to support and stimulate those pathways. Hey, brain tissue, you've kind of been shut down. The brain is lazy. It will always find the path of least resistance. But as we're working, I can feel where, hey, they're not quite accessing that part of the brain. What can I do to come in, literally manipulate the brain, bring the tissues together to encourage? I give them an offer they can't refuse. Hey, brain tissue, I want to wake you up a little bit. I need you to work left to right. I need you to cross midline. to come and work that side. So this is the work we're just starting to work on. We're really excited. We've got 3 patients we're starting to run through. We're working to find data to see, hey, how are things changing underneath our hands? But we're seeing. So here's what we're seeing, here's what we're feeling. So we're just starting to document all that work. So I just wanted to introduce this to you. Again, there's so much more to come to this as I have more time to share this and record this. But I just wanted to get this out to get you started on helping you understand Alzheimer's, how to support your loved one with Alzheimer's, and how to take care of yourself.